Hello everyone, this is Dr. Irfan Kamaruddin Andani. The topic which we are starting today is cephalometric analysis. In this playlist, you will also find the anatomy which is visible on the cephalometric radiographs, important landmarks which you should be able to identify, and how to trace lateral cephalometric X-ray. And from today, in a series of lectures on cephalometric analysis, I will try to give you a basic concept that why do we do cephalometric analysis and what is the use of that. Because there are more than 200 analyses available in this orthodontic world, and it is not possible for me to cover all of them, but once you have grasped the basic concept, you will be able to understand various analyses by yourself. So let's begin. Now this is the commonest question that is asked usually: what are the uses of cephalometric radiograph? The most important use of this X-ray is the diagnosis of your orthodontic patient, and that will be the main focus of our today's lecture. The other use can be to observe the growth changes and growth pattern in your patient, or even in populations in which you want to study the craniofacial growth. You can also measure the treatment changes with the help of this radiograph, especially in orthognathic surgery patients. Like if you want to compare the changes before and after surgery, you can measure on this radiograph. You can also predict the growth, and you can also have some idea about the growth spurts in your patient with cervical vertebral maturation method. And sometimes you also find some pathology accidentally. But today we will discuss that how to diagnose the problems in your patient with cephalometric analysis. But before that, you should know that what is norm and what is deviation from norm. For example, having 5 fingers in your hands is a norm, but having 6 fingers is a deviation. Why am I saying that? Because most of the population have 5 fingers in their hands. What if majority of people have 6 fingers in their hands in a population? Then having 6 fingers will be a norm, and having 5 fingers will be a deviation. In the same way, a straight profile is a norm in most of the population. Like in this patient, if you draw a straight line from glabella, this line is more or less in contact with the upper lip, lower lip and chin, or in other words, you can say that his mandible and maxilla are perfectly aligned. That is the reason he has a straight profile, which is a norm. However, in this patient, you can appreciate that the profile is severely convex. Maybe due to mandibular deficiency or maxillary prognathism, whatever the reason is, but the profile is convex, which is not normal or deviated from the norm. On the other hand, this patient has concave profile. Her mandible seems to outgrown the maxilla. This is also a deviation from the norm. Now, it is very important to treat an orthodontic patient. You should know that what is the reason for these deviations. Is it just because of the teeth, or the reason is skeletal? Is it maxilla or mandible, or both the jaws are affected? And here where comes the cephalometric analysis, and it plays a very important role in diagnosis. You must also keep in mind that we are living in a 3-dimensional world. Every face has a vertical dimension, a transverse dimension, and antero-posterior or sagittal dimension or plane, and your patient can have deviation or abnormality in any of these planes. But unfortunately, the lateral cephalometric radiograph is a 2-dimensional X-ray. You can measure and diagnose problems in sagittal plane. Like in this patient, she has mandibular prognathism, which is a sagittal problem, due to which she has a concave profile and class 3-ish appearance. The other dimension that you can measure in lateral cephalometric radiograph is vertical plane. Like this patient has increased lower facial height as compared to his midface. So this is a vertical problem. However, the third dimension or plane, which is transverse dimension, you cannot see in lateral cephalometric radiograph. Like this girl has deviated mandible. Her chin along with the jaw or mandible is deviated towards right side. This is a transverse problem. Similarly, in this patient, there is a cant of upper lip. This may be due to problem at the level of occlusion, or maybe maxilla is affected or mandible, but this is also a transverse problem and you cannot measure on lateral cephalometric radiograph. For that, you will need either posterior-anterior cephalometric radiograph or CBCT, cone beam computed tomography. I have shown here the normal profile of a patient which you will see in lateral cephalometric radiograph. Let's assume a patient comes to you with the complaint of excessive overjet, but you do not know the reason behind that and you want to find out or diagnose that whether this problem is skeletal or just a dental one. And if it is skeletal, is it just a sagittal problem or vertical plane is also involved? And which jaw is at fault, maxilla or mandible or both? These are the questions you would like to know before starting the treatment of this patient, and that is the reason why we do cephalometric analysis. I will go into the detail of these analysis in my next videos. Till then, have a good day.